Okay, thank you. Yeah, I'd like to welcome everybody to the February 6, 2024 Ashland Board of Health meeting. This agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other agenda items not listed may also be brought up for discussion to the extent permitted by law. So with that, we'll call the meeting to order at 6:02. First order of business, or then following that is always citizens participation. I know Mark usually has something he wants to say. What do you got, Mark?
Thank you. Good evening, Mark Sony, 49 Hawthorne Road. What I wanted to talk about, I asked in person to Rajat. I came into the town hall the other day last week, asking about updates or anything that goes on in the medical field and anything that happens. So that was my questions to him, and there was a little bit, not really too much, but I kind of noticed on the agenda there might be a couple of things on there that might be talked on, and it's in your report, the health your report, Richard. I think it's the third one down. I forgot what the title is. I think it might be the third one down.
Mm-hmm.
Are we talking about the Medical Reserve Corps?
That, and I think it's one or two up after that.
Yeah. Well, I mean, we'll get to his report, Mark. So
yeah,
yeah.
Kawashi knows what I was asking him about. He saw me at town hall last week.
That is correct. Yes. Thanks. Mm-hmm.
Yeah, I'll just leave it at that. Thank you.
Thank you.
Okay. All right. Thanks, Mark. Thanks, Raj.
Thanks.
Okay. Raj, you want to lead in with the Marathon Deli food manager issue?
Right, sir. So I see Mr. Doug is here. Mr. Doug, you are on mute actually. So this is extension from the last meeting. I guess Mr. Doug has some misunderstanding. He was supposed to be in front of the board last meeting because he didn't have a certified manager for close to 3 months. So we was concerned about that, and the issue being resolved now, but the board still wanted to see him, given that. So
yeah,
that was it, so.
Yeah. Okay. So, uh-oh. We'll try to wait. Can you get it off mute or no? Yeah, well, it's not going to do any good if we can't have a conversation. Want to try to log out and log back in, Doug? We still can't hear you.
Laura, you want to see if you can unmute him? Is there any feature like that?
No, I was just looking to see if there was. It only says I can ask to unmute.
Yeah. I know with me, if you hit on the screen, it should bring it up on the top, Zoom meeting with, all of your things, mute, stop video, share content, all the participants. You don't see that?
It would be down the lower left-hand corner where the microphone is, where the red line. Hit the red line and the green will come up.
He's
there
on.
You go.
Guys, can you hear me now? Or
Excellent.
Yes.
Gotcha.
all right, awesome. Thank you.
Okay.
Now we can continue.
Yeah. So Doug, we just wanted to chat with you a little bit, just because the rules regarding the certified food manager, having somebody on site at all times, is something that was instituted a long time ago, and it seems like 3 months isn't an inordinate amount of time. Do you have any explanation for that?
So listen, like I explained to Mr. Gupta, that it was a complete oversight. We dropped the ball. Okay.
Okay.
All I can tell you the board is I fully understand where you guys are coming from. We've been in business for over 26 years. Okay. I did my due diligence just to let you know, you can look through the whole chain of emails that were sent to the Board of Health via Laura and to Mr. Gupta, stating
Yep.
what I was going to do and the time frame it was done. And from the time that I was told, from the time that I was told that I had to do stuff, I had my due diligence completed by the end of December. I even took the class. I can prove the documents. It was all sent to Laura at the Board of Health, stating that I passed my allergen certificate by December 28th. I did my food service manager course now. I did that, which is like a 6 or 7 hour course. I completed that by December 29th. I just couldn't get my scheduling in for the test, the actual test. And I guess what I want to say to you is, since COVID, a lot of things have changed, especially with these testing things. A lot of people don't call you back. You send emails. There's only so many people that you can do it through. So I did that, and I told Mr. Gupta on my last conversation, as he told me, I said, listen, I will have my certification by January 13th, which is a Saturday, okay? Which I did take the tests. I did pass. I did forward him the information, but he said he still wanted me to go before the board. And all I can say is that, if there's any issues with any type of business that's in town, you guys give so many days to come into, to be conforming. My idea is, listen, I didn't postpone this. I did it as fast as I could. Now it was the holiday season. It's December, around Christmas, around the, New Year's Day. So I did try to work it in, and I did do what I had to do before the end of the year. Okay. Stating that what I was going to do was going to take place. So on my end, I believe that I did everything I could to explain my situation and take it from there, and then have it completed. So we are completed. Both people here are both food certified, certified. We have our certificates, and I don't know what else to say.
No, okay, no, that's fine. Obviously, we're glad you got it done. It was just more of a timeliness issue. I think that the Board of Health, in town, the people that run it day to day, Raj and Laura, it just seemed like, that 3 months is a long time, and that usually most restaurants should know that. I think it comes up with your licenses every year that there needs to be a certified food manager, there at all times. So
sure. Can I just
that you should be aware of, as I'm sure all the other restaurants are aware of. So that's just a long period of time to go without that. So we don't want to close anybody down. We don't want to be a pain in the ass. If Raj is telling you that that's an important thing, you just have to keep in contact with him. We know you're busy. You have a great, terrific restaurant. Everybody knows it. You've been in business, I agree, for a long time. It's just that if he is really going to ask you to do that, just try to keep in contact with him, especially if it can't be done on a relatively timely manner. That's really all that this is.
No. So listen, can I just interject for just 1 second, just to explain myself? Okay. Like I said, we did drop the ball about not being, certified at that point. But from the time I found out, which was the second week in December, to have the work submitted. Okay. When my conversations started with Mr. Gupta, I completed my whole end of doing that, so it would be completed by the beginning of January. So.
Okay. No, we know you're in compliance now. It was we just wanted to impress upon you, that Raj is there to help everybody. He's not there to hurt. It's his job to make sure that laws that are already written down are just, our people are kept in compliance. That's really all it is.
I completely understand.
Yeah. Ed, Dave, Barbara, anybody else, on the board have any comments? Jay? Questions, concerns? No? Raj?
That's all, sir. So
Okay.
again, I thank you, Mr. Doug,
Yeah,
But
Yeah,
my
no worries.
impression, I want to make sure, I mean, board knows it, from the emails I got it and the conversation I had with you, I was getting the impression that you're too busy to take the exam. I have that in writing from you.
No, no,
And
like I said, it's just the scheduling aspect of it. Like I said, with COVID and stuff, to get these things scheduled in. Plus, I'm not going to lie, it's my busiest time, with the restaurant business. At the end of December, December, Christmas, January, it is kind of a rough time. But I
Yeah.
did do like I said, I did have everything completed by the end of December, except for the test.
our problem is, restaurants have sicknesses whenever they are busy. I'm dealing with a salmonella outbreak just right now. I have 2 cases in the town that I'm working on. So that's my problem, like
Sure.
you want to be in compliance because once there is a sickness, there is state involved.
Right.
So first question they're going to ask me, like, why it's not compliance and what's going on. So once there is sickness, it's go past us, it goes to the state, the DPH get involved. So just want to make sure that we stay on top of it, and that's all.
Oh yeah, no worries. I completely understand. Like I said,
Thank you, sir.
Okay.
no worries. Thank
all right. Yeah, all right, Doug, thanks a lot. We appreciate it. Thanks for coming in front of the board. And,
Yep.
Good, you have a great business. Good luck with everything. I'm sure.
Thank you so much.
Everybody will be, all right. Yeah, thank you. Have a good night.
Yeah, thank you now.
Okay, you too. All right. Raj, you're up again on item 4, Mill Pond Rest Home.
Yes, sir. So we do have a recomplaint, regarding the bed bug issue, and
Mhm.
both Mr. Sweeney and Rita was in front of the board September 5, when there were some commitments made. And I just want to make sure and that, and they're going through a change of ownership. I'm a little concerned that the bed bug issue is, it's like 8-9 months now, so I just want to know why this is not solved. First question is that. Second is Mr. Sweeney have told the board in September 5 that the kitchen will be brought into compliance, and it's not been done so far. So, and I just want assurance that the new owner knows all this, and I have informed Mr. Sweeney that we won't be able to give the new person the food permit till the kitchen is brought into compliance.
Thanks, Raj. Ron, I just want to say it's, I think part of that too was that originally back in September, we had put in the notice with Department of Public Health to close. And then during that time, we had a buyer come in. And so we rescinded that with the Department of Public Health, and we were maintaining treatments in the building as well. But there's only a few residents, and every time, every 45 days when the building is treated, we only seem to find it's isolated in one room. So we've tried other methods as well to try to make sure that is eventually gone out of that one room. That one room, unfortunately, we have a resident in there which hoards a lot of clothing. We've washed the clothing over and over and over again, and they have multiple visitors that come in. So we don't know, if they're popping them in from the community, because we, historically prior to this, it really wasn't an issue. But no, the treatments are ongoing, as well as Raj, with the sink. I think I sent you over the quote. We weren't planning to do it when we were putting in the list to close, but when we rescinded it, we brought in a new plumber, and the plumber said he could do the job. So the quote is there, and they've ordered the item for the 3 sink.
But I need an application, so I need to know before you're gonna buy the item that it's certified equipment. So this was on the 25th. I sent you an application. I have no response. You cannot buy equipment without us being looking at what equipment are you buying. Like if it is commercial grade. I mean,
Okay. I'm sorry, because they had sent a quote over, Raj, and I assumed it was sent over to you.
I have not gotten any response for the application. So I mean, are you sure that the equipment is certified and it all that stuff? So we need that before
I
we can
believe the
go ahead,
plumber had submitted an application for a permit, and they're a bigger firm that we brought in from outside. So I will make sure, I will talk to them tomorrow morning and make sure that we get back to you on that, so that you have the specs in front of you.
And my
But
other
they wouldn't order that sink if it wasn't in compliance.
I mean, that's on you, sir, like if till I have the spec sheets, I can say that if it is or not, so
Right.
I will need the application, need to be reviewed, and then we go from there. My
Yeah.
my major concern is now the new buyer, is he aware about the situation, about the bed bugs and all that, like
Right. Yeah, no, we've kept them up to date with everything.
but this is like too much of time for me, like for somebody, I have people calling, outside agencies calling regarding this situation at Mill Pond, and I I feel for that person. When I went this time, I find like 3, 4 bed bugs in the beds, right? Like, I mean, it should not be that way. This is like 8, 9 months now, like, I mean, this need to be taken
Right.
more seriously, instead of blaming it
But
on her,
I think, well, I think when we were here last time, we were talking to you about how the company comes in and they can only do it every 45 days. They won't come in and do it before that because they said the treatment has to last that long. So they were in on December 13th and they came in this week. So it has been ongoing for the treatment of the building.
Do they give you a reason for that 45-day window, even if there's active pests that are found?
Right.
Is it a toxicity thing?
Yeah, what they've told us, Ron, is that it takes that long in order for that to really go through. They've
Okay,
told us not to treat it on our own in between treatments. So it's kind of hand tying in that event.
yep, okay. Yeah, I don't know enough about it to comment. I just didn't know if it was, if there was
Right.
a health hazard to, the actual occupant, if it was done more frequently than that.
Right. Yeah,
Yeah.
we don't want to go in and just bomb the room because again, it's tricky because the resident refuses to move. So, and they have a many number of bags of clothing that they
Yeah.
brought in from the community. So, and they've been washed and washed, and we've utilized other things. We've gone out and bought special bedspreads, and everything else. But for some strange reason, only in that room that we find one or two, and if, we
Yeah.
don't know if it's due to visitors or what's going on.
Yeah. Yeah. Okay. And any other members? Barbara, Jay, Ed, Dave? Nothing? All right. Okay.
No,
Raj, I will be in touch tomorrow.
thank you, sir.
Okay. All right. Anything else, Raj? You're good?
I mean, I just want this to be done, sir. This is
Okay.
taken too much
Right.
of the time, and I just feel for the person, living
Yeah.
living with bed bugs can be,
Yeah.
can be mentally challenging, like it can be, it's very hard, and this time I went, she had bites, I find bugs, and it's on the report too. When Terminex went yesterday, they say they found live activity,
Right.
so.
Yeah.
Right, and we've offered to move her, Ron, and Raj, and we've offered even to transfer her if she likes, but she just refuses. She's
Yeah.
kind of stuck where she wants to be.
Yeah. Raj, is there any validity to the fact that she may have a lot of clothing that could still be infested with that in her room if she's not necessarily the cleanest or, has stuff that's been sitting there for a long time? Because it would seem to me that that would be, feasible that would happen. And then, they're going to get back in there, especially if it really is only that one room. It seems logical that there could be a connection between how the room is kept, which I don't know how much control over, Matt and Rita have of that versus, the other rooms. I don't know how that is.
Dr. Ron, the stuff was definitely bagged, I won't say the room was unsanitary, but there was stuff in the bags, so
Yeah.
that's there, but like that much time, they are hard organisms, right? Bed bugs are very difficult to get rid of once you have
Yeah.
them, right? But like 8, 9 months is too much of the time,
Yeah.
right? Like,
Okay.
so that's like my concern, so.
Okay.
Hey,
well-
Raj, does the patient have the right to refuse to move out of the
Yes.
room? Okay.
And Dr. J, that won't help, I will say like, so now if it is later to one person, like you're gonna move the problem too, so like, I mean, I will not say technically that's the right approach, like if you're treating, they should be, I mean, Terminex is a good company. I don't know where the lapses are, right? Like, but there is something definitely missing that they are there for this long.
Yeah.
Matt, do you have the outside of the door of her room, do you have those sticky pads down so if they try to escape from there?
Yeah, we've got exterior stuff, just not treatment that will conflict with Terminix's treatment.
Yeah.
So yeah, we've been pulling our hair. We've been monitoring what's been going on in the North Shore school systems out in Northampton. I mean, they've had infestations as well. We're trying to piggyback and copy those treatments. It's frustrating.
Yeah. Yeah. All right. Well, we know it's frustrating for everybody. All right. Well, Matt, just do your best to keep, Raj informed to,
Absolutely.
And so,
nice for him.
thank you, Dr. Ron. One
Yeah.
last thing I want to mention, right, before the new owners come, they need to transfer the licenses from us, right, especially the food, so that process need to start, right, whenever, I don't know whenever your transfer is, but like they need to get the food permit from us before they, come or
Right.
take over the facility, so just want to make sure.
I did make them aware of that, Raj, after we spoke.
Thank you.
You're welcome.
Okay. All right. Matt, thanks. Rita, thank you.
Thank you, Ron.
All right. All right. Okay. All right. Moving on to item 5. My God, I can't believe I was here for the first one. The 7th annual Mary Mortensen Public Health Award. We're going to try to see if we can, discuss a few nominees today. Does anybody know a little bit about the history of that? I know, I know Laura probably does. I know a little bit, but Laura, worked with with Mary, for a long time. You want to give a little preamble, Laura?
Oh, weren't you there? I thought you were there the first year we did it, right?
Yeah, I was.
And
You
so
just
it'll
know the
be
history of what
year
what
7.
she did more. I know I was half expecting to see Diane, but she probably didn't. She probably didn't realize we were doing this. She was always pretty good. But
Yeah.
how long was she on the Board of Health, Laura? Like a billion
30,
years.
I believe 30.
30 years.
Yeah.
Yeah.
There is a list of accomplishments. I can send that to the board and I can have that.
Oh my, she did vaccination. She took her own, she did it by herself. She was, she was big into the, the smoking thing as well. And
Yeah. She
yeah.
did a lot of bylaws. The head injury.
Are we looking for
Yeah.
nominations?
Yeah.
Yes.
Yeah. So that's eventually
So-
what we'll do. I just didn't know how many, how much people know. Like, I know Dave's new, and
Yeah.
she, she did a lot for the town for a long time. So,
Right.
We wanted to try to, honor her memory by, somebody who did, something, outstanding, let's say for the town. So, Ed, you have a nominee?
I do. I would like to nominate our school nurses.
Yeah, I think that's beautiful. I'm sure they're doing a lot.
They
Yeah.
are the front line to a lot of stuff, and what they do every day is just amazing.
Okay. Anybody in particular, or just as a group?
I think we should do the whole group.
Okay. Yeah. And, not only because, the only other person I really know in town, I don't know as many as you do, is, Jay for, spearheading the whole RAM thing. And then being, I guess, not smart enough to say no and do it again this year. So I think that's an amazing accomplishment. And, whoever, would take it would be, certainly worthy. What an undertaking. Jay did a terrific job last year, and obviously another one this year. And, obviously that includes you, Ed, and, and Raj helping, Jay with all that stuff. But that's an amazing thing. Anybody else have anybody else, or, know anybody else?
I would just say, yeah, Ron, team
Yeah.
effort on that RAM one.
Yeah, I know, but you still, you brought the idea up, you made it happen. I don't know that anybody, you did, you had help and, terrific help by, Ed and a lot of the other people in town, but you still made it happen. So,
Thanks.
yeah. Yeah. So is this something where we vote on this today, Laura? Laura, are you there?
I just said that if everybody is good with Ed's nominee, they can, make a motion. Somebody can make a motion.
Okay. So anybody want to make a motion for either of the two?
Actually, is that okay, Raj? Is that because it's not, doesn't say on the agenda motion, doesn't say,
Yeah. I don't know if
it
you
just
have
says,
a formal vote, but
Should be,
it says,
but
it says discuss nominees. It doesn't
Oh.
say vote.
We're gonna
So
have a tie
maybe,
vote. Because it's
Yeah.
gonna be, both are so good.
Yeah, I just had a question on that though.
Yeah.
So Ed, I know we gave it to you. I thought it included the school nurses last year, no?
I guess it was, so it was given to the fire, police and the school nurses last year. So yes, we can
Oh,
look
okay.
more into that, but uh, Chief, I know, we wrote one of those to Audrey,
Okay.
and but up to you. If you want to nominate them again, like that's totally great, but like if you want to wait. Sorry, sir.
we could,
Well, I was
you know,
looking like if we have already given them, maybe it would be nice to come up with a different candidate.
so we can always, we still have plenty of time, to
Yeah.
do this. So, we could, at least review the few people that we spoke about today and think of a few more potentially and revisit it next meeting. Would anybody like to do that? Does that sound
Yeah,
okay?
I like that idea. I thought
Yeah.
tonight we were just kind of talking about it and
Yeah.
we
Okay.
would vote
Yeah.
at another time.
Okay.
But you can always talk around people around town like regular citizens too,
Yeah.
who
Mhm.
get outstanding things.
Yeah.
Mhm.
There's such groups.
Yeah. That's true. That's true.
Yeah.
Okay. All right. So we'll review this again next time. Laura will throw that on the agenda, and then brings up to at least one of our potential nominees. Jay, you're on tap. Number 6, RAM Clinic update.
All right. I've got a few things in no particular order. So we'll have our first RAM CHG meeting next Tuesday. So that's when the CHG group meets with the RAM representatives, which are the volunteer coordinator and the clinic coordinator. And that'll be good because that's kind of an official kickoff of the planning process. The fundraising is almost underway for the clinic. I just need to have RAM approve some of the messaging around that. A couple of the flyers that we're sending out with some new stats on the last clinic that we did. And but once that gets going, we'll be out fundraising in full swing. In terms of recruitment, Ed Berman and Dave, I know that Zoe reached out to you by email. I made that connection. She got in touch with you guys. Hopefully you saw that. And I've also been able to contact 2 dentists. One of them I'm going to follow up with on Thursday. And he's from town here, a retired family dentist, and seemed pretty enthusiastic about helping us. And I'm documenting all this. I don't want to step on your toes with recruitment, but there's a recruitment log in the CHG online tools. So I've been putting down the people that I talked to just so that you don't have to go back after those folks. And then there's somebody from Tufts that I reached out to. So recruitment is happening, and I think that is going to ramp up as well after our meeting next week with RAM. Let's see. I am scheduling a meeting with the Edward M. Kennedy Center which was not involved last year. And many of you may know the EMK Center is a community health center, which does a lot of great work in Framingham and surrounding towns. So that would be, if they wanted to partner up with us, either for follow-up care or just as a general partner, I think that would be huge. So hopefully I can get that meeting going either this week or next week with them. As far as other things go, Ed Hart, our promotions guy, he is starting his efforts in promoting it to patients and general volunteers. Laura, I know that you connected him with Melissa Hayes, and so he'll probably do an interview with her and get featured in either the town newspaper or Michael's weekly correspondence. Steve Mitchell is doing the hospitality work for us like he did last year. That really doesn't start until a bit later on, but I'm sure that he's thinking about budgets and stuff like that and coming up with refining his general plan. So that's about it. I would say that we've kind of officially started our activities in this regard. And I'm happy to let Dave or Ed chime in if anything's been going on with you guys. But other than that, that's my report.
Great. Thank you.
Yep.
And just on a personal note, thank you for, getting me all squared away. So.
Yeah, you're good. You're all set. Yeah.
Yeah. Wherever doesn't matter. If I don't have anybody to see, I'll just be there doing whatever you tell me to do, whatever you want for both days. So you'll let me know.
So if you don't have anybody that has any podiatry needs, will you do general medicine or just general check? Like what more would you do?
I would do what I did last year. I would just try to help the docs any way I could, just hang around with them. But if there's anything else you need, I don't really care. Whatever you want me to do.
Yeah. Okay. Excellent. And I think for
both days. So.
Yeah. And as we had discussed, and we can talk about it offline too, Rob, but the follow-up needs,
I can help with that.
Phone call. Yeah.
Yeah. During whatever you want me to do is fine.
Okay. All right. Excellent. Excellent. Thank you.
Okay. Yeah. Thank you.
All right. And Barbara, I assume you'll be involved this year if you can be. So if you have any questions about signing up, or if you want me to remind you how to do that or whatever, just let me know. I went through the list of volunteers really quick, and so I did not see your name there. And if it is there, I apologize. But if you need any help, I'll just say, for those of you who are trying to get yourselves and your friends signed up for it, it's not the most user-friendly application form. So if you do not get an email back from RAM saying that you're signed up for the Framingham Clinic on August, whatever, 10th or 11th or both, if you don't get that email, then something didn't get into the system correctly. And if that happens, go back and look at your account. And if you're still not getting the email, just let me know and I'll try to help you out with that. So.
Okay.
All right.
Yeah, I'll definitely be there.
Okay, great. Thank you.
Mm-hmm.
All right. Great. All right. Thank you. All right. Moving on to agenda item 7. Raj, you're up again.
Thank you. So we did get a grant from the BBA regarding the shop disposable containers. That's what we're going to use the grant for. I guess the department got this earlier too, I guess 2020, something around 2021. So we use these monies to buy the shop containers for the citizens, for the residents, right? And we have 2 kiosks that one is located at the town hall, one is at the community center. And both the places have the shop containers that we buy through this grant. So anybody who needs to dispose shops properly, they can get it from us and then dispose it at the town hall as well as the community center. Easy convenience, there is a change of ownership. We had a couple of items pending at the store that we're currently working with the owner. One was mop sink that they didn't have it, so they are in the process to install it. And the other was a 3-bit sink that they needed, but the owner and the new owner, they are agreeing to not serve anything that needs sanitization So they're gonna be removing any coffee they are serving at the establishment. So we're gonna have them not put the 3 basing for right now, till they feel the need that, they need to serve something like that needs sanitary process, and then at that time they gonna need the 3 basing. So that's ownership changes going on right now. MRC, we had an update and we sent it to the board, the list of the members. And Dr. J, I know last year it was not very successful, we getting volunteers for the clinic, but this year, now we have a new coordinator. Her name is Michela, right? We can talk to her and probably bring more volunteers for the RAM clinic. And a general list, I've sent it to the board, and they have another meet and greet on the 27th. If you have time, we can go meet them, there. She's gonna be there. So if you think it's good time and you're available, it's 6 to 8 in the evening, and we can do that connection, So let me know if you are available, we can go talk to them.
Okay, I will. Thanks.
Lot going on at the town regarding the housing, picked up good number of cases. Again, 3 active at Chestnut Place Apartments, though getting better. I did get an email from them to get compliance, for one of the case. Still some issues at the dumpster. Serious Apartment, I'm actually had 4 citations so far, 3 for trash, that non-maintenance of trash at their dumpster compactor area. I had to issue one $200 citation yesterday and a $300 citation today. Ongoing issue is like almost more than 6 months, so they're not resolving, so hopefully that get done. 137 Pond Street pending. The brothers, one of the brothers, the younger brother, was at town hall a couple of times, and it seems the motel they was living, he was living, he's not living there anymore due to financial situation, and town is trying to help them with that, so social worker is dealing with it. And hopefully we have more from AG's office regarding the case. 213 Trailside, again, another housing case is we have not got compliance, and I have to issue 1 citation there as well. With the disease investigation, we're currently investigating 2 salmonella cases active. They are part of a outbreak of a restaurant in Sudbury, and they have a location in Easton as well. So 2 of our residents got sick from that restaurant in Sudbury. There are 13 active cases of salmonella from that restaurant so far. So I was working with the director of Sudbury as well as the state, to look more into that, the cause of the disease, what happened. And we picked up 1 TB case from last board meeting, and we did have another chicken pox case at one of the schools, that we are working on. Flu COVID clinics going on. We had 1 clinic today. We did 8 shots, though less people who are needing the vaccines at this point, and we have another one on the February 27th. And the childhood vaccine clinic continuing every Wednesday. And with the pharmacy, we have done 374 shots so far this season, that includes flu, COVID, we are doing RSV, tetanus, shingles. And the pharmacy, we can offer home visits to any person who cannot come out, we can send the nurse to the home as well. So that's for the residents. And I'm open for any questions for the board.
Raj, I have a question about the Sudbury restaurant. Is that closed or is it open and being monitored? What is the protocol?
Right, so I'm not aware about the closure, I guess what we are getting to, and more will come out of the investigation, it might be unpasteurized eggs that were used at the location that caused it. This is where I was. I did speak with the Sudbury director, in fact, today, so this is where inclining towards, one particular day, the batch of the eggs was bad,
Mm-hmm.
and it might be that the restaurant was getting eggs straight from the farm, and they probably was not pasteurized. But more will come out of the investigation, and I'll ask DPS, as well as Sudbury, what caused it, But like we have 2 residents that ate there, and it's confirmed, they got it from there.
Yeah. Got it. Thanks.
Yes, sir.
Anybody else?
Could I just
Rod,
say that, could I just say one thing that
Yeah.
Raj had talked about the Sharps containers, that was
Yeah.
also one of Mary Morrison's accomplishments, that she started that program for the Sharps containers, as well as a long list that I can send you all
Yeah.
too. That was one of them.
No.
Thank you,
Yeah,
Laura.
thank
Thank you.
Yeah.
I actually got the privilege to work with Mary, actually, when I was at the Framingham Health Department. But she used to work
That's
there.
right.
I got the privilege to work with her, actually,
Yeah.
so
Yeah.
she was a great person.
Yeah.
Yes.
Definitely. And Rod, just as a little public service, just for everybody, along with the Sharps, I always kind of think about drug take back, which I think is available all the time. I know there used to be one, Ed, if I was right, at the police station. Is that still available, or are there other venues that anybody can drop off any prescription medicine that they're not, they're not looking to throw away?
So I know they don't have it at the police department anymore,
Okay.
but they do have it up at the community center.
At the community center. Okay, good to know. So that right now, that's the only one in town then?
That is correct, Dr. Ron, and Mr.
Okay.
Berman actually helped us with the disposal last month.
Okay.
It's kind of, our department is overseeing it right now, but it's more of the PD thing, but like the bin we had was full, and was locked for a couple of months, so
Yeah.
Jeff, our facilities guy, and I have to empty them out, and we got like 2 big boxes of drugs out of that, and Mr. Berman helped us with one of the boxes, and we have shipped it. It's now you can do that, but eventually we have to at the Board of Health level or the town have to figure out the maintenance of the box.
Yeah.
That's something we are working on, but currently we are looking into it. I mean, the health department is looking.
Okay, great. All right. All right, thank you. All right.
Well,
Anybody
one more,
else?
sorry, one more thing, Ron.
Yeah.
Raj, just real quick, circling back to MRC, I just looked at my calendar. On the 27th, I have a RAM related meeting at 6:30. So I won't be able to go to the meet and greet, but please feel free to connect that new MRC director or coordinator with me. I'm happy to describe what we're trying to do.
I will certainly do that, sir.
Okay.
I'll connect you with her. Thank
All
you.
right, thanks.
Okay. All right, moving on to the consent agenda. The review and approval of Board of Health draft meeting minutes for January 16th, 2024, and review and approve fiscal year 2024 and year-to-date budget reports. Anybody want to make a motion to approve the consent agenda as written?
I will make a motion. Oh, sorry. Go ahead, Dave.
Good time.
First motion.
I make a motion to approve the consent agenda as written.
Okay, all right, that's great. Any seconds?
I'll second it.
Okay, thank you, Ed. All right, all in favor? Aye.
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 All right. Thank you, everybody. That passes 5 to nothing. And anybody have anything that they'd like to, bring up next time? It usually always gets relatively filled with Laura and Raj. Yeah. Nothing.
No.
Okay. All right. Well, I'm sure there'll be stuff on there. And right now, I guess we're slated to meet on the 20th. Is that correct, Raj? Yeah. Okay. All right. Any final thoughts? No?
Nope.
Okay. All right. Anybody want to make a motion to adjourn?
I'll make the motion to adjourn.
Okay, thank you. Second?
I'll second it.
Okay, great. All right, all in favor?
Aye.
All right, thank you,
Aye.
everybody. Thanks, Mark, for attending like you
you.
always do. All right.
Thank you
we'll
very
see you in
much.
a few weeks.
Have a good night.
Bye.
Have a good
Bye,
night,
Raj.
everybody.
Bye.
Thank you. Thank
Bye,
you.
Laura.
Bye.
Good night, everyone.
Good night. Thank you.